My name is Satish Nadig. I'm the Edward G. Elcock Professor of Surgery. I am also the Director of the Comprehensive Transplant Center and the Chief of the Division of Abdominal Transplantation here at Northwestern Medicine. I'm a transplant surgeon and basic scientist as well.
My name is Andres Duarte. I'm a professor of medicine and a transplant hepatologist. I am the medical director of Liver Transplantation and the medical director of the Living Liver Donor Program.
We've decided as our programmatic priorities for the liver program is to really bolster living donor liver transplantation, as well as not only our national reputation, but our international reputation with the Northwestern International Transplant Exchange. Our goal at Northwestern Medicine, especially in the Division of Transplantation and the Comprehensive Transplant Center, is to be an international trendsetter in transplantation. So we very strategically put forth a Northwestern International Transplant Exchange where we exchange not only ideas, but also clinical and academic practices across both peer institutions globally, but also developing countries as global diplomacy to help start other transplant programs across the world. We have started a clinic in the Middle East, and we are working on transplant exchanges with other countries.
So apart from opening clinics throughout the Chicagoland area, so that patients in the state of Illinois, and especially in the area close to Chicago, can have access to our physicians. We also have specific clinics that address equity that are directed particularly to Hispanic and African American patients that need liver transplantation. We are multidisciplinary. We have transplant surgeons, we have transplant hepatologists, we have transplant infectious disease doctors. Our nurses are really important and key for the development of the whole program.
It's the ultimate team sport. It not only includes all of the healthcare workers, including social work, psychiatry, hepatology, and the surgeons, of course, but it also includes our community. Our community has to be engaged in order to increase organ donation awareness and to provide support as living donors, for example.
In the United States, we have a real problem with access to organs for liver transplantation. So of approximately 12,000 patients who are added each year to the transplant waitlist, only about 9,000 get transplanted. So there are about 2,000 patients who die on a yearly basis waiting for a liver transplant. That's about 5 to 6 patients dying on every day while they are waiting for their life-saving donor. It's one of the best strategies that we know is really valuable and can impact on the access to transplantation is having living donors. People who just want to help somebody else and want to save somebody else's life just by donating part of their liver. Any liver transplant candidate can become a candidate for receiving a living liver donor. There are multiple studies showing that no matter how acutely sick the patient is, that patient can still be saved through living donor transplantation. Regarding who can donate their liver, we're pretty much talking about people who are healthy, no major chronic disease, have particularly a healthy liver. They need to be younger than 55. There should not be any severe obesity. We will evaluate them, and if there is no contraindication, anybody within these characteristics can become a transplant donor.
Beyond the risk of surgery in and of itself, the risk for the recipient is very similar to a risk of any liver transplantation, but the caveat is the recipient is guaranteed a better quality organ, so ergo, they will have a better outcome. The way we characterize the risk for the recipient in a living donor liver transplant is really that much of that risk is mitigated by the fact that they get a good quality organ. For the donor, it is a major operation, yet the risks are quite low because we've become fairly facile at the operation. So there are risks of the operation itself and injury to structures within the liver and around the liver, but those risks are less than 3%, and the donors do quite well and gain the emotional satisfaction of saving someone else's life. The Comprehensive Transplant Center is committed to serving not only our population here in the Chicagoland area and being a national trendsetter, but to be really an international trendsetter in liver transplantation. But it's important to us to have quality at the base of this mission. And so it's very important that we underscore our mission of a patient-centric impact through quality, innovation, and education. And living donor liver transplantation emphasizes all three of these points.